Hi, I'm Ashley Josie, and I'm the Injury Prevention Chair for the Brazos Valley Regional Advisory Council.
And I'm Ashley Kopek, and I'm the Education Chair. Our mission is to provide the Brazos Valley with a comprehensive trauma, acute care, and emergency medical system.
A person who is bleeding can die from blood loss in as little as 5 minutes. Therefore, bystander intervention can be crucial to saving a life. Stop the Bleed is a nationwide campaign to empower individuals to act quickly and save lives.
In this video, we will teach you 3 important steps to stop the bleed: pressure, packing, and tourniquets. We hope you walk away from this training remembering that anyone at the scene can act as an immediate responder and save lives if they know what to do.
Stop the Bleed enables people to provide immediate frontline aid until first responders are able to take over care.
You cannot control the behavior of others,
but you can always choose how to respond to it.
Welcome to Stop the Bleed. My name is Dr. Matt Jordan. I'm the Trauma Medical Director for Baylor Scott & White Hospital in College Station. We are performing this program in conjunction with the Brazos Valley Regional Advisory Council. This program was developed to educate and empower you to recognize and intervene on life-threatening bleeding. The program was developed as a cooperative effort between pre-hospital, hospital, as well as military personnel to educate the lay public in how to manage and assist with life-threatening injuries associated with bleeding. Where can this training be used? Bleeding can be encountered from accidents at home, at work, in the car, or anywhere in public. You must be ready at all times to intervene to save a life. There are many mechanisms that can result in life-threatening bleeding. Some of these may be related to car accidents, injuries with glass or knives, and can occur at home or at any place that you may be. The focus of this program is to be able to identify life-threatening bleeding and then be ready to intervene to save a life. Your safety is the first priority. In order to help others, you must not be injured. If the scene is not safe for whatever reason, you should remove yourself and, if possible, remove the victim from danger and then intervene when it's safe to do so. Personal protective equipment should be used if at all possible. Avoid direct contact with blood or body fluids on your skin, eyes, or mouth. Wear gloves when available, and wash your hands immediately after contact, even if no blood is visible. The ABCs of bleeding control are A. Alert 911, B. Assess for bleeding, and C. Compress the bleeding. You should call 911 immediately to request assistance. The 911 dispatcher may ask questions about what happened, when did it occur, where are you, the number and status of the victims, and any ongoing threats to your safety. Life-threatening bleeding is continuous, large volume, pulsatile, or enough to pool on the clothing or on the ground. The faster it is controlled, the better the person will do. Make sure to assess for multiple sites of bleeding. Assess the back and extremities and underclothing. The principles taught in this course apply to external bleeding. This can occur from the extremities, noted in blue, from the junctional areas, noted in green, such as the neck, armpits, and groin. These junctional areas can have large volume bleeding due to large caliber blood vessels that run through them. The third location, noted in red, is the torso. Internal bleeding in this area can only be controlled with advanced maneuvers, and patients need to be transported to a hospital as soon as possible. C is for compress. Pressure will stop the majority of bleeding. Start by using a small amount of gauze or material, just enough to cover the wound. Excess gauze or material makes pressure ineffective. If gauze is unavailable, use any clean material. Apply pressure directly to the bleeding site. The application of pressure may require a significant amount of force. Apply enough force to stop the bleeding and continue to apply this pressure until help arrives. In this video, you see the use of direct pressure to the bleeding site to control bleeding. This is an effective form of bleeding control in many cases. If the bleeding is from a large or deep wound, Superficial pressure may not be adequate to control the bleeding. You may need to pack the wound, pack it deeply and tightly, and then hold pressure. Be careful, as there may be sharp objects or fragments of bone within the cavity. Once the bleeding stops, do not check the wound, simply hold pressure until help arrives. This video demonstrates the packing of a deep wound. Pack the wound deeply and tightly until you can fit no more material in the wound, and then hold pressure externally. Hold pressure until help arrives. Packing can be used at any of the sites of bleeding on the body. The final form of control is the use of a tourniquet. Tourniquets should be considered for extremity bleeding that does not respond to pressure or packing. The tourniquet should be applied 2 to 3 inches above the wound and do not place over the elbow or knee. You tighten the tourniquet until the bleeding stops, but do not remove the tourniquet. Avoid placing the tourniquet over bony prominence or joint. Tourniquets can be applied over light clothing. However, remove any bulky clothing such as a jacket. Also, if placing over a pocket, ensure that the pocket is emptied first, otherwise the tourniquet may be ineffective. Continue to tighten the tourniquet until bleeding stops. Occasionally, 2 tourniquets may be required to achieve complete hemorrhage control. Placing a tourniquet is a painful procedure. Severe pain is expected. Do not remove the tourniquet until help arrives. This video demonstrates the application of a tourniquet. The tourniquet can be placed on yourself or on someone else. The tourniquet is applied and the strap is pulled snug and velcroed. The windlass rod is then turned to tighten the tourniquet until the bleeding stops. Once the bleeding is stopped, the rod is secured in the holder. Ensure to note the time that the tourniquet was placed. Several tourniquet models are commercially available. The Committee on Tactical Combat Casualty Care and Stop the Bleed program have approved the tourniquets shown here. You will receive demonstration and hands-on activity with the windlass rod type tourniquet, shown above as the CAP tourniquet. These will also be available in every classroom in your school. Shown here is a list of all the approved tourniquets of the Stop the Bleed program. Bleeding control in children is the same as in adults. Direct pressure and packing use the same techniques. Tourniquets can be used in children as well, except for the very small child if the tourniquet is too large. In these cases, direct pressure on the bleeding wound is the best way to control bleeding. Some questions that arise involve impaled objects. If there is an impaled object associated with the wound, do not remove it. Leave this in place and allow medical personnel to deal with it. Improvised tourniquets are often used. One must be careful using a belt or a necktie for a tourniquet, as it can be difficult to obtain adequate pressure to stop the bleeding. Use an approved tourniquet if at all available. Loss of an extremity can occur with the use of tourniquets. However, it is rare. The phrase of life over limb is appropriate in this scenario. Pain may also occur with the use of bleeding control or tourniquets. One must apply significant pressure to stop bleeding and may cause discomfort. This is expected. If you have any other questions, these can be answered at your hands-on skill sessions. This program provides basic principles for response in a bleeding emergency. First, Ensure your personal safety and make sure the scene is safe. Next, call for help. Call 911 and ensure that they know your location. Assess the person for bleeding. Apply pressure with direct pressure, packing, or if necessary, a tourniquet, and then wait for help to arrive. For more information, visit bleedingcontrol.org or stopthebleed.org.
So we have identified that the patient has a sucking chest wound. Once the wound has been identified, you're going to take your chest seal. You're going to use the red perforated edge. You're going to pull it back. You're going to take the dressing out of the kit. You're going to take the gauze. You're going to wipe around the wound to make sure that it's nice and dry so that the dressing can be applied. Once it's dried, you take the chest seal, you line it up where the center is over the wound. You will adhere all sides. And now it's complete.